Welcome back to Quick Hits, where we sit down with the leaders shaping the future of healthcare IT. I'm your host, Tyler Smith, and today's guest is someone I've had the privilege of watching grow through the ranks of this industry, and I'll tell you, it's been something to see. Nitin Agarwal is the CIO of Wayne Memorial Health, a rural health system in northeastern Pennsylvania, and he brings a refreshingly honest, people-first perspective to healthcare technology. In our conversation, Nitin talks about what it really takes to earn trust across clinical, operational, and IT teams, and why the best CIOs lead with conversation before solutions, and what he believes it means for a hospital to truly be a friend to its community. Nitin also shares some sharp perspectives on data migration, the AI hype cycle, and why rural health systems can't afford to be early adopters just for the sake of it. This is a great one. Let's get into it. Welcome back to Quick Hits, where we bring you quick, impactful conversations with leaders shaping the future of healthcare IT. At Health Data Movers, our mission is to empower patients and providers by unleashing the potential of healthcare data and technology. So we're always excited to explore how that's coming to life inside health systems. Today, we're joined by an incredible leader, Nitin Agarwal, CIO of Wayne Memorial. Nitin, welcome to the show.
Thank you, Tyler. It's great to have to be here with you and chat with you. We've had a couple of very decent conversations, so I appreciate it.
Yeah, I'd say mad decent, as the kids say. Yeah, well, Nitin, it's always a pleasure to chat with you, and now in this formalized fashion. Maybe if you want to just kind of start us off by telling a little bit about yourself, your journey, your role at Wayne Memorial, and how you got where you are today.
Sure. No, that's a great question. So, Nitin Agarwal, CIO here at Wayne Memorial. I've been here now just about going on about 7 months now. Had a wonderful experience here with this hospital. They're really, really, they give me the opportunity to really help them in a lot of different ways, right? Because they're so focused on their patients and on their community. That's their driving motivation, and I think that's something I've identified with quite a bit. In terms of how I got here, I've had the opportunity to work in almost every different avenue and realm of the healthcare space in the IT world, and just kind of worked my way up to where I am now, and had the opportunity to meet some great people like you and people that really believed in me being successful.
Yeah, and your story is really inspiring to me because I remember getting to know you as you were moving up the ranks, and you've worn a lot of hats.
Yeah.
Would be interested to know like what advice you can like you've made it to the C-suite, to the top dog role in IT. Like, yeah, what are some of the lessons maybe you learned along the way, or the skills that you were intentional about building up?
Yeah, I would honestly say one of the biggest skills and one of the biggest lessons I learned is to trust my people, right? Trust the teams that I work with to be good at what they do.
Sure.
Because if I don't, then they shouldn't be in the roles that I have them in, truthfully, right? So that honestly was something that took a lot of work for me because I am so used to wanting to do it all and kind of just jump in and do it myself and kind of really just be very hands on with it. I think what I had to realize is I have very, very smart people that work on my teams, and I need to trust them to do what they're good at doing.
Sure.
And then the other thing I would say is just learning to work with other leaders and work with other folks that are in the space, right? I think too often departments and teams kind of get into the mindset of, I am my own individual, I am my own team, and
Right.
that's it, and they kind of stick their hand in the sand. I've made it a point to really be more intentional about that and partner with all of the different areas that I work with, rather than saying, hey, I'm IT, I'm only going to do this piece of it. You're clinical, you do this piece of it, and that's it, and not go anywhere else from there. I've really partnered with them to make it like, hey, look, I'm your partner in this, I'm on your side, you're on mine, we're going to figure this out to do it together.
Right. Yeah, it's such an interesting lesson, especially for folks with the builder background, learning how to. I remember the time when I had to abscond responsibility or abdicate or whatever we want to call it, delegate. I think is the right word.
Yeah.
But it definitely takes a leap of faith. If we shift gears a little bit from the micro to the macro, so when you think about the role of technology in healthcare, how do you make sure it's actually improving the experience for patients and providers and not just adding complexity?
Yep, I'm with you. I think the biggest thing for me is making sure that the technology is actually solving the problem that they're having. I one of the quotes that I use quite often is don't find a solution, don't find a problem for a solution, right? Don't
Mhm.
just, AI is the buzzword of the day, right?
Right,
Every company, every organization, every hospital is really focused on AI and what they want to do with AI. And that's kind of, they'll find things to make AI work in their system, right?
right,
So my goal has always been make the technology solve a problem that I have. I'm not
right,
going to create a problem just to implement the technology.
right. Yeah, that solution looking for a problem. And how do you then go about um, defining the real organizational or the real problems, so that the problems come before solutions influence what?
Yeah,
Yeah.
I think it goes back to the conversation we were having about being a true partner to my
Hmm.
clinical teams, to my leadership teams, right? Being
Hmm.
on the same page as them, having those conversations very actively to say, look, what are you seeing? You know what I mean?
Right,
What are your pain points? What can I really do to help solve those for you, right? Like
right.
where are you struggling?
Yeah,
And depending on where you're struggling, let's figure out a way to help you be better. Because again, let's be honest, right? At the end of the day, if you didn't have the clinical teams, you didn't have the right leadership, there is no path forward. There is
right.
no success for a hospital. And the only way you actually get that success is by really pushing that forward.
Yeah, so you talk about the different teams, the different stakeholders. So obviously, you're bringing together the clinical, operational, IT. How do you build trust across these groups when you're driving change?
Yeah, I think it's honestly just being very honest, right? That's one thing
Hmm.
I'm very, very forward about. I don't, and I think you've heard me say this. I don't really like to talk out of two sides of my mouth. I
Sure.
am, what I feel is what I'm going to share. What I think is what I'm going to share. I'm not going
Yeah.
to have a lot of, I'm going to tell you this and tell someone else this. I think that in itself builds a lot of trust because they can see that, right?
Right.
Clinical teams see that, like, hey, he's telling me this, he means this, and he's doing his best to get me to that solution. Same thing with leadership. It's, hey, look, I'm going to come to you and I'm going to give you all the facts, right? I'm not going to dribble some things out and then come back later and ask for more, do more, whatever. I'm
Right.
going to tell you right up front, here's the cost, here's what it's going to be running, and then go from there.
Yeah. Sometimes telling the truth can be tougher, right? When there's
Yep.
a hard truth to tell. Do you have any examples or reflections on those maybe tougher moments and how you handle them and what folks can learn from how you handle them?
Yeah. So I think what I would just say is be okay with being uncomfortable, right?
Hmm.
The I think what a lot of times people get caught up in the uncomfortableness of a moment or a conversation or a struggle,
Right.
and that's the only thing they focus on, right? They become laser focused on that piece of it. And
Right.
I think for me it's about, you know what? It's okay. I am uncomfortable right now.
Right.
It's okay to be uncomfortable. There is a path forward from here. There is a way to get there.
Yeah. Living in discomfort. It's the only
Yep.
way we grow, right?
Yep.
Um, so yeah, then again, sort of building on that theme, but looking more in terms of the challenge of your so you and I obviously we have we've we first met in urban back in an urban setting, but now you're working in a rural setting.
Yep.
So what are some of the biggest challenges that you see when it comes to access to care, particularly for the rural communities?
Yeah, I mean, listen, I'll tell you. prior to this organization, I've mainly worked at mid-size and large-size organizations, right?
Mhm.
So I had a very different perspective and a very different understanding of them. I
Right.
think coming to work here, I truly understand the need for organizations like Wayne Memorial because there are folks that are in the surrounding area that don't have access to care. If we weren't around, if we weren't here, if we weren't within, and in some cases it's an hour to 2 hours for them.
Sure.
So it's tough, right? It's really tough for them. And I think that's what it really comes down to is being able to provide them that care, being
Right.
able to be that. And I liken it to being that friend when they're in some of the worst times of their life, right? Because again, they can talk to their family all they want, they can talk to their friends, but they don't understand the struggle that they're going through, the pain that they may be feeling, or the the uncertainty of their medical condition, and the
Sure.
hospital truly does, and the nurse that's working with them truly does. And that's something that's very, very important to me. And I yeah.
Yeah. So being that friend, so building on that. So how do you see technology and data really helping in that effort of being that friend for those individuals in the rural health system that are in need?
Yep, I will say I think the way I see it is it really technology is meant to help the folks that are frontline, right? That's the whole point of it. That's the goal of it. That's why you really implement all the different technology stacks that you do. You provide your frontline teams the ability to focus on the patient the best way possible without
Right.
being hindered by their tech stack, right? And I think
Yep.
that's a very, very important piece of conversation is
Mhm.
that at the end of the day, the technology has to do what it can to help the people that are actually working with those patients. And that makes it so that in some ways, we are also helping those patients, right?
Sure. And when you think about hindrance and non-hindrance, like do you use checklists? What are some methodologies or frameworks you use to help your team think through? Is this going to hinder? Is it hindering? Is it going to help?
Yeah, so I'm really big on conversation, right? I have very active conversations with my teams and my
Mhm.
leaders that are, under me, my managers. I bring them into all of the conversations and things that I'm thinking through. I really
Sure.
solicit their opinion, and really try to figure out what's the best way to make it work. Um, and that's really my way, right? It's
Right.
very active conversations. It's making sure everyone has a say in it, and figuring out how that works. Yeah.
Yeah. No, and definitely appreciate the qualitative aspect of that. When you have these conversations, you talk to these different stakeholders. How do you ultimately come to a decision? Do you have some process where you synthesize what you've learned, or do you go meditate, or what's your what is your decision making process post conversation?
Yeah, I think for me, it's really sitting in the moment, right? So
Hmm.
very similar to sitting in the uncomfortableness. As you can tell, I really like to sit in my feelings, right? And
Sure.
it's I like to be sure that the decision I take, the path I choose, is going to be the right one.
Right.
So I really focus on that, right? So when there's a decision to be made, vendors to pick from, a direction to go, I focus very heavily on it, figure out what is the best way to make it work, and then
Right.
that's the path I'm going.
Yeah. And yeah, you mentioned you've been at large organizations before, like with more resources, if you will, or more access to
Yep.
resources. So as you're making these decisions, like how much are you weighing like the scarcity that you have that's now a part of um, where you're gonna how that influences like what you select technology wise and how that makes the impact.
That's a really tough question to answer. I'll tell you honestly. Um, I think what it really comes down to is being very decisive in my conversations on how to proceed, right?
Yeah.
With my teams, with my leaders, and making sure everyone's on the same page, right? I'm not one to jam something down anyone's throat.
Right.
I'm not gonna push things to a point where I want to do this, so we're doing this, unless
Right.
that's what needs to happen. right?
Yeah.
Sometimes that's what needs to happen.
Sure.
And if that's the case, then that's the case. I'm perfectly fine making those calls if I
Right.
need to. But I think for me, it's really making sure that everyone that's involved has a say in the decision and understands why we're going that route.
Sure. Yeah. No, I can see how your conversational approach can engender buy-in, but sometimes maybe
Too
buy-in
much
doesn't.
conversation.
Yeah. Yeah. But yeah, definitely appreciate you sharing how you are decisive and you do make decisions in those conversations or through those conversations. Um, so shifting gears a little bit,
Mhm.
obviously we're a data firm. It's the second word in our name.
Yeah.
How do you think about data as a strategic asset versus just something you're managing on a day-to-day basis?
Yeah, that's a great question. And Tyler, it's a bit of a loaded question, sir, because as you know, the whole interoperability guidelines that are coming out right now are really structured right around data, right? And I
Right.
think the way I'm going to answer that is this. I think data is a hospital's most valuable asset in the
Sure.
long run,
Yeah.
with the thought that that data at the end of the day belongs to the patient, right? That is
Yeah.
the patient's data to do what they want to do with. So I think the way I see data is we need to utilize that data to give the patient the care that they deserve and the care that they really need, right? And
Mhm.
if that means making sure that we have a full understanding of what was done with them in the past or at other organizations, I think that's very valuable. I
Sure.
think data allows you to make the best decision for a patient's health. And if you don't have enough of it, you can't do that.
Yeah. It's interesting because it's like, if I think about it, and I don't love financial analogies to healthcare because finance is obviously complex, but also so much less complex than healthcare in many ways. It's almost like, so now the hospital system is not just like providing the care, but they're also the custodian of the data, which belongs to the patient, like you said. But in effect, you're not just playing care delivery, you're also playing like banker of patient data,
Yep.
which is a big responsibility.
I agree with you, and I think that's a key that you brought up, right? Because again, hospitals have to be very mindful in how they're storing that patient's data
Sure.
and making sure that data is protected. Because again, that's the patient's identity, and I think that's something that I'm proud to say every hospital I've ever worked at has been very diligent about and very true to.
Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now back to the show. Sure. So obviously, movers is the third part of our name. So we talk about moving data a lot here. And given you might not be part of a data migration, but you definitely have been over your career. Um, before you've executed on a data migration, like what do organizations need to get right um, before they start the process, or maybe in the early stages of a data migration?
Yeah, I would say mapping your data, right? Knowing exactly what things your data equals to. So, for example, if you're doing a migration of a lot of different things, your current system and your new system, if you're going to a system, right? If it's a repository to a repository, has to equal and map. You
Right.
don't want to have your data end up in the new system and it doesn't equal anything, it doesn't map, and now you're spending significantly more time, effort, and money to fix all of those issues.
Sure.
I personally believe that you rather spend all that time on the front end, make sure your teams understand exactly what you're trying to do a one-to-one map and say this equals this needs to go here, And once you have that, you obviously do a practice run, right? You send a little
Right.
bit of data just to see what happens, see if it maps correctly. And then that's how you transition the rest of it over. And then also understand your space, right? Understand the volume of data that you have and the volume of data you want to bring over. Because I think too many times the thought is, I just want to just bring everything over, right?
Right.
And a lot of the times that's not worthwhile. A
Right.
lot of that data might be older, a lot of that data might not be useful or valid anymore. I think it's just being very intentional and
Mhm.
using those data migration times, I'll say, to clean up your system as well.
Sure. You and I are discussing moving in general, so there's some obviously analogies. But, back to those points. So clearly successful migrations, there's great mapping or intentional mapping. You're doing test runs, and sorry, more intentionality around the actual the data that you're selecting to move and the volume. Um, like what else do organizations do that, or is that all? But what else do the successful migrations exhibit?
Yeah, I mean, I think there's a ton of steps, right? There's
Right.
101 steps that go into a successful data migration, but I think at the end of the day, what it really comes down to is making sure you have your plot lines, right? You do your
Mm-hmm.
due diligence on everything that you're moving over, how you're moving over, what it's mapped to. So, for example, one of the things that we're looking at is doing a migration for our PACS RIS and cardiology systems, right? All the
Mm-hmm.
stuff that we've stored there. We need to make sure that a mammogram here maps to a mammogram there. We need to make sure that this value, this reading, this item maps appropriately. And I think the other bigger piece of it that a lot of times is somewhat forgotten is making sure, again, all of your teams are on the same page. It can't be siloed in IT, siloed in health, in the clinical side. It's got to be everybody's at the table, everybody's talking about what's happening, everybody has a say in it, and we all work together to move it forward.
Yep, love it. Reminds me of the last executive. Well, we just did an executive dinner recently, but the other one we did before was called Beyond the Silos. Um, so yeah, very important.
Yeah.
All right. So we've done a little introspection. If you look ahead 3 to 5 years, shoot, maybe even 3 to 5 months sometimes with the pace of change, what excites you the most about wealth, where healthcare is going, and where are you planning to help lead it?
Yeah, I am very, very excited about the next 3 to 5 years. I think right now we're in this very tumultuous phase where AI is finding where it lives, right? Where is its place in the healthcare ecosystem truly? Not just every single company that wants to solicit a contract or a vendor contract right now slaps AI on their name, right? Because it's almost like a lot of hospital systems won't look at you unless you say there is some AI in it.
Right.
So what I'm really looking for in the next 3 to 5 years, maybe 3 to 5 months, is AI finding its stronghold, finding the places where it can truly be actionable, not just the fly by night companies or not just the fly by night vendors that spin up something that they think will help and you adopt and then all of a sudden it's not there anymore or it doesn't work the way you want it to. I'm looking forward to the day where AI and the tech stack can actually let the clinicians just truly be the clinicians, right?
Sure.
I was at a wonderful, wonderful summit with Chime just this past week in
Sure.
Camden, and there was a very smart gentleman named Dr. Stesiak there, and he presented an image, a painting that truly mattered to him, and the painting was of a doctor that was sitting next to a very sick patient's bed and
Okay.
his entire concentration and attention was on this patient. And the doctor is in this pose of very, very thoughtful pose. And
Sure.
it was, you could see how much it meant to this provider to care for this child
Got it.
and just giving them all of the attention. And I think that's very important. And I think, AI is going to really be able to help us do that in the long run.
Right.
Um, and then in addition, I think AI is going to really help us as as hospital leaders, generate more revenue so that we
Yeah.
can implement more things. We can do more things to really help our patients be successful in their care.
Love it. All right, we're gonna do a quick lightning round. What is one technology trend in healthcare that's being overestimated today?
That is a very hard question because I think there's too many, right? I think it's early adopters, right? That's what I'm going to go with.
Yeah,
Only because larger organizations, and I'm going to only speak from the rural perspective now, okay?
sure.
So I think larger organizations have those big bench dollars to just say, yeah, we're going to be an early adopter at this, we're going to try it. And if it doesn't succeed, it's 100K that we're able to write off on our bottom line, right?
Right.
For rural organizations, smaller organizations, that's not always the case. For us, we have to be very, very intentional with what we adopt and what we move forward on.
Got it. What about the flip? What's a technology trend in healthcare that's being underestimated today?
I think bringing the patient into their own care and letting the patients have a say in what they're
Sure.
doing, right? Again, just to reference the Chime Summit in Camden,
Yeah,
there was a great person from Dana-Farber, right, that I was speaking with, and she was one of the faculty there and presenting about it. They talked about how they've really brought the patient into the conversation about
sure.
what do you want to see, what's going to help in your care, what technology are you really looking for, right? And I
Yeah,
think that's impactful. I mean, obviously there's the negatives and the positives to something like that, but I
sure.
think it makes sense to bring the patients into their own care because again, if they're coming to a hospital, it's because they really need it.
Right. Nitin, always an absolute pleasure. Obviously, first time we've done this formally, but I
Yeah,
always look forward to seeing you at these events and, also just running into you in general.
yeah.
Best of luck at Wayne. They're super lucky to have you as a leader. You have so much hands-on experience and also so much incredible leadership experience and perspective, but also enthusiasm that you bring to the organization, and can only imagine what you're going to be able to do there. And we'll be excited to watch it all happen.
Thank you, Tyler. I really appreciate it. And I want to thank both you and Brooke and obviously HDM and Sidious for letting me come on here and having these conversations. And honestly, I'm very thankful for your friendship as well because we've had the chance to really bounce a couple of things off of each other that I think were very valuable. And I know definitely been valuable for me. So thank you all.
Well, that means a lot. Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on YouTube, Spotify, and Apple Podcasts. And don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.